Medical errors are the third leading cause of death in the United States, just behind heart disease and cancer.
An alarming statistic from our nation's healthcare system: preventable medical errors resulting in death. But how can you know if the hospital you or your loved one is seeking care from is truly safe?
Medical errors are serious, and we need to work on reducing those close to zero if we can.
Paul Peach is the president of the Health Policy Corporation of Iowa. It's a nonprofit organization striving to improve the quality and affordability of healthcare in the state.
Hospitals work on improvement all the time, and we just encourage them to do that with a consumer in mind and performance in mind.
HPCI represents 23 counties in Iowa and 1 in Nebraska. But when you look at national hospital safety,
Hospital Safety Grades. It's our attempt by employers and other people to try to get a handle on reducing medical errors.
Enter the Leapfrog Group. It's a nonprofit organization created by healthcare professionals with a goal to make giant leaps forward in the safety and quality of U.S. hospitals and healthcare. Twice a year, Leapfrog releases grades for the nation's top hospitals, and these grades are based off of a number of different data points, public records, and are decided upon by a group of medical professionals. Sioux City's Mercy One Siouxland Hospital and Unity Point Health St. Luke's are both part of the Leapfrog grading system, and in spring of this year, both hospitals earned themselves a C grade. Before we break down the grades for each hospital, let's talk patient safety. Leapfrog defines patient safety as how hospitals and other healthcare organizations protect their patients from errors, injuries, accidents, and infections. According to Leapfrog, as many as 44,000 people die every year from preventable hospital errors. 1 out of every 25 patients will develop an infection that didn't have to happen. And Medicare patients, they have a 1 in 4 chance of experiencing injury, harm, or even death. Leapfrog's hospital safety grades look at 28 separate safety measures that are given a ranking from below to above average. Those measures are then put into 5 categories: infections, problems with surgery, practices and preventable errors, safety problems, and doctors, nurses, and hospital staff. Looking at the infection category, neither Mercy One nor St. Luke's stand out, but they also aren't among the worst. According to the data, you are more likely to get a blood infection at St. Luke's, but at Mercy One, you're more likely to see a surgical site infection. Now, while both hospitals are below average in these measures, they aren't alarmingly so. Now, speaking of surgery, both Mercy One and St. Luke's are rated among the best when it comes to not leaving an object in a patient's body cavity. But St. Luke's did receive a low score regarding patients developing a serious breathing problem during or post-surgery. If we look at the physicians themselves working to prevent medical errors, both Mercy One and St. Luke's are about average. But when it comes to staff at each hospital working to prevent those errors, both Mercy One and St. Luke's are ranked among the best in the nation. Patient safety while under the care of hospital staff gets its own category. St. Luke's tops the list here twice, especially for tracking and reducing the risk to patients. The final category is given solely to a hospital's doctors, nurses, and staff. It's here where both Mercy and St. Luke's receive high marks in the matter of having enough qualified nurses on staff. St. Luke's also tops the list for hospital leadership making patient safety a priority. Leapfrog safety grades are released every spring and fall. Mercy One has been at a consistent C grade since spring of 2016. St. Luke's, on the other hand, has been a bit of a roller coaster. From the spring of 2016 to the spring of 2017, St. Luke's sat at a C grade. The fall of that year, they dropped down to a D before rising once again in the spring of 2018 to a C. Fall of last year saw them rise up even more to a B grade before dropping down to a C for the most recent report card. For those who don't visit Sioux City's 2 main hospitals, Omaha and Sioux Falls Medical Centers also receive semi-annual grades. There are 8 major hospitals in the Omaha Council Bluffs metro area, with Methodist Jenny Edmondson Hospital receiving the only A grade. Sioux Falls has 2 hospitals, Avera McKinnon Hospital and Sanford University Medical Center. Both of them received C ratings for the spring of 2019. With all of this data, you might be wondering, how can I use this information to make sure I'm getting the best healthcare possible? The best thing you can do is ask questions.
We're asking patients and consumers to get more involved, asking questions, maybe seeking second opinion, and maybe taking an advocate with them when they go for care. That way they're more proactive. By asking questions, I think it's a long ways toward getting improvement.
Overall, Peach says hospitals in Iowa do provide really good care, but there is always room for improvement.
The individuals in medical care people are dedicated people and are caring people, doing the best they can, but humans make mistakes. So the process they use, the methods they use, is where the improvement needs to occur.
With these grades, Leapfrog's goal is to inform the public, with the hope that hospitals will work on making improvements to their patient care.
I think transparency is the way to go, because where providers see their performance being measured and available to the public, transparent, there will be improvement.
In Sioux City, Katie Koppel, Siouxland News.